Oh my God, are you casing out a location for JPM meetings already? What are you doing? Is there the pot bagel behind you?
Don't tell people where we're going to be.
Nobody wants to go there.
Otherwise they'll charge $50 an hour for seating.
Nobody wants to go there. It's the Pre-JPM Health in 2.00. Oh my God, what are you wearing? Why are you wearing a hoodie?
Well, maybe it's because of this.
Oh my God, you need a haircut.
I'll be all groomed by next week, but I just came back from Tahoe. I have my winter look on.
Like a wild mountain man thing going on.
It'll be gone by next week. Don't worry, Jess.
Oh my God. Let me see the rest of that hoodie.
I know. You like this? This is an old one from Alex Drain. Look at this.
Nice. Seduce Health. I've got my WTF Health on right today.
You're probably going, WTF Health is Seduce Health, and I don't remember. Maybe Alex does. Anyway, do we have a...
You're the last person who has that shirt.
Probably.
Right. We've got like a million deals to talk through. Do you have your timer ready?
Already? I thought that was next week.
Oh my God, no. Everybody's throwing their cash around already. I'm so excited.
All right, here we go.
Love it.
I think my rumor from last week hasn't closed yet, although I found a note about it.
Your Softbank rumor? Did you get scolded for that?
No, it's I found a note that actually in the Japan Times that they were thinking about this company, Alto Pharmacy, but they haven't announced it yet.
Ooh, everybody's on Google right now, Matthew.
All right, anyway.
Let's go. Set that timer. 2 minutes. You got it?
2 minutes and
2 minutes. Here we go. All right.
Yep.
OneMedical files its S1. Key takeaways from this one.
Finally, it's going to happen. Key takeaway is there's a bunch of weird money stuff in there. A lot of people like Dan O'Neill and some others on Twitter trying to figure out what it was. How are they raising money from employers, and how are they raising money from hospitals, and not raising money but getting paid. I don't quite understand some of that. It's a big number that their valuation for the amount of money they're making and the growth they're going. But hopefully it'll do well. We'll see. I am a patient, so I want to keep going.
Okay. Crew from Sweden raises 155 million. What is this?
Oh, this is so telemedicine, doctors on demand, American World type place for Europe. Sounds like a hell of a lot of money. They were getting relatively low utilization, I heard now, but that's 400 and something million in. It's a big play for telemedicine in Europe.
Speaking of a hell of a lot of money for not a lot of action, ClassPass raises an E, 285 million, valuing it over $1 billion.
How much has gone in now to that lot?
Oh my God, like 500 million, I think, something like that.
I would take from this that you're a tad cynical about ClassPass. You actually use that kind of stuff more than I do, and I never go to the gym, so who knows? But apparently selling stuff as gym memberships, I don't quite get what it is, but someone believes it.
At the stronger employer health game. Anyway, Komodo Health, 50 million from Andreessen and Oak is in this round. This is a pretty rich round here for this.
Yeah, I talked to them just in advance of Christmas, and they're pretty interesting. They've got a really interesting data set with a lot of really interesting stuff on it. The question, which I don't know the answer to, is they don't have identified data, so they can tell you a lot about the doctor and the kind of patients they've got, but they can't quite get to the doctor.
Okay. What about LeanTaaS? They've raised 40 million.
Oh, there's the one. Yeah.
I knew it was coming. I was like, stop.
You just got it in there. So LeanTaaS is interesting. There's another company called Qventus. There's a bunch of other people. These are people trying to do the kind of, can we do really clever AI to figure out what's going on in the world of things like scheduling operating rooms, scheduling emergency rooms? Can we improve the process inside the hospital? So when I talk about, the health tech, people are trying to replace the current system versus the people who are actually trying to improve the productivity of the current system, they're in that bucket. It sounds like a lot of money to me for, for what is sort of incidental analysis that could come out of some of the other bigger players. But on the other hand, it means that, you know, maybe in the end a Cerner or an Allscripts will snap them up. But again, the valuation is probably pretty high.
Okay. Good. Good to know. Good to know that deals are closing left and right. We haven't even gotten to JP Morgan yet. Exciting stuff.
Well, there's definitely going to be more next week. Some of the stuff is announced in advance. But the other thing is both the Rock Health and the Startup Health numbers came out, and last year, 2019, which is already last year, is slightly down on 2018, although, you know, not that much. Just,
I'm not surprised.
10%. No, because the year before was so crazy. But, I mean, you know, at some point, the chicken's got to come home to roost, and people are more interested in exits than they are in input. And you're going to see, you know, obviously OneMedical is going to be the first, but you're going to see another bunch of these companies. I would think that 23andMe and Doximity and a bunch of others, probably Amada, are going to have to think about getting out this year. And as we know, there's a potential for a recession at some point because we've been going for 10 years now, and, you know, maybe the recession will be put off until after the election by some hook or by crook, but maybe we'll go to war with Iran tomorrow. We were going to war with Iran 2 days ago. We're not going to war with Iran today. Maybe we'll go to war with Iran and it'll go to the toilet. Who the hell knows? But, you know, I would think that a lot of these people will want their money back, and so I'll see more exits than inputs.
Honey, save this banter here for the cocktail parties at JP Morgan. You're giving it all away. Nobody's going to want to talk to you now. We've heard it all.
I'll come up with something else.
Oh, I'm sure. How's your happy hour list going? You done?
It's building. I'll be at Startup Health for a bunch of time, and then wandering around on Sunday. I'll be at Doc SF on Sunday.
WQO Group's luncheon. I'm moderating a panel there.
Oh yeah, you are. Yes. I didn't even get invited to that, but I'm going to the rival.
There's a reason why.
I'm going to the 120 over 80 lunch at the same time, which is the guys that spun off from WTO Group. So
they have the nicest food, is what you told me.
would I go somewhere just because I have a nice steak?
Absolutely. Yes, absolutely.
But there'll be. You can come and see me and Jess. Probably most nights you end up in what's that place that you like?
The Cliff, the Redwood Room, if it's not closed for a private party. Do you know, fun fact, that's where this show was invented over several drinks at the Redwood Room a couple JP Morgans ago. We should go film an episode there in honor.
All right, I can see it. Tuesday night around midnight in the Redwood Room. We'll do a fantastic version.
We'll be filming another one of these. If you guys want to follow along with all of our JP Madness, please do so. Follow us on Twitter. I'm at Jess and Matthew. He is, of course, at Bolty Boy. Oh my God, do not put that hood back on. You're creepy.
I think it's in honor of the new Star Wars movie, or is it the old Star Wars movie?
What's your hair in honor of? Because that's pretty bad. You have to fix
hair is in honor of.
I'm not going to the Redwood Room with you.
I will look slightly more presentable by next week, I promise.
Oh my God. All right. Well, find us, you guys, next week. We're going to be filming episodes of this so you can catch up on all the madness. We'll try to bring you a glimpse at where we're at and some of the fun different places and people that we run into. We love to have guest stars on our show, so come find us. All right. Subscribe to these. To get these Health in 2.0 is right in your inbox by going to thehealthcareblog.com, subscribing there, and that's it. I will see you soon, my friend, and let the happy hours begin. Thanks so much for watching, you guys.